know, it's never been more important in my estimation for people to have a personal family physician. There's a lot going on in the industry with medical advancements, and you want a doctor who knows something about you personally, about your medical history, about your medical conditions, the medications you're on, so that if you have an emergency, you can call on them to help you and treat you. So I went on a campaign a couple of years ago to visit with the community and sensitize them to the need to have a family physician. And what I heard back from the community is that it's difficult to find one. So we came up with the idea of developing a physician referral line.
But I took over the physician referral program 2 years ago, and it has blossomed and just grown to amazing proportions. We have helped over 400 people now get established with doctors of all kinds. When a person calls and they say that they need a physician, usually the volunteers will answer the phone, and once the volunteer finishes taking the person's information, then they'll bring it to me. I just look and see who's taking new patients, that takes their insurance, and that can take care of their needs.
We have a lot of seniors in our community, and one of the challenges that we experience right now across the country is physicians are closing their practices, or at least minimizing the number of Medicare and Medicaid patients that they take. And so it was very, very challenging for people to call around from one provider to the next and have the offices say, "I'm sorry, but we don't take Medicare and Medicaid patients." So in the initial evaluation, when we called around to physician practices, we really wanted to understand what the limitations were within that practice. So if there was a physician that didn't take Medicare or Medicaid, or if they didn't do OB patients, or some other restriction, we knew that up front. And if when the patients called and told us that they were a Medicare patient, we knew exactly where to send the patient, because we had a list of the physicians and the providers, some of them were mid-levels too, that were willing to take Medicare patients. And it really did prevent the patient from getting frustrated and from having to call the community and running up against this issue when they were calling on the phone. So part of the beauty of this model is that, and we keep a list, we make sure that the uninsured patients get shared across all the physicians that are taking new patients. The other thing that's been a benefit to us is we have 2 clinics in town, a federally funded community health clinic and a physician volunteer clinic. And both of these clinics are really established to help those that don't have the means to pay or that are uninsured. And so we've been able to help direct some of these uninsured patients to the federally funded community health clinic. There's a lot of individuals coming into our emergency room seeking emergent care in the emergency department that really, if they'd seen a primary care provider, probably wouldn't even need to come into the emergency room, where care is the most expensive in our healthcare system. So we've created, with our business office that do admissions there, we've just asked people if they would like help to find a primary care physician, and we've made sure they know that we've got this service available to them. And if they've said they'd like a phone call, then we give these folks a call down the road and ask if we can assist them with finding a provider. And we've helped people in our community that are accessing our emergency room to find a better way. As far as our future plans, we plan to continue to offer this service as long as there's a need.